there, it's Rob Balko and
Dr. Stephanie Lipnicki
here again with the Practical Medicine Podcast, the podcast that focuses on bringing awareness about the many ways to maintain your health and heal your body, mind, and spirit, from acupuncture to Zen living and everything in between.
I tried to make that as a tongue twister just so it would be fun for us when we,
Mission
when we
accomplished.
say it.
Mission accomplished.
I decided to add a little side note about our mission statement in terms of acupuncture and talking about bringing awareness of what we do. In the United States, there are roughly 328 million people. And as of 2015, there were 34,000 acupuncturists, and I like to sometimes put my math geek hat on. So that leaves us at each acupuncturist needs to reach 9,500 people to spread the word of acupuncture. So I feel that there are so many people that have yet to hear about how amazing we are.
No pressure on us.
No, but it allows us to reach more people and help the other acupuncturists.
That's right.
Reach more people.
Because we can't do this alone.
No. But in New Jersey, where we are, as of 2015, they estimated that there were 923 acupuncturists and 8.82 million people. Wow. So that means we have to reach 9,600 people. So that's,
I'm going to have to start working weekends.
I didn't say you had to treat all of them, but
Bring them all to you.
yes, bring them all to me. So I just thought that I would share that because that's one of the reasons why I felt like I wanted a podcast that would allow us to help other acupuncturists as well to reach other people and to get the word out about how great acupuncture is. So today's topic for our fifth podcast is going to be about acupuncture and gynecology, which we both treat. And I kind of make that one of my, top three things that I treat are gynecological conditions.
And in the future, we'll delve in more deeply into some of these topics. Today is going to be a broad brush stroke of all of gynecology.
Right.
There's so much of, and there's such in acupuncture history. There's this long documented history of treating it successfully from onset of the period to
menopause. Yeah,
and everything in between, and all the complications that arise from pregnancy or infertility, etc.
Right. And I feel like the reason we had talked about separating some of those things out was because we wanted today to just be a broad overview. And some of the questions that were coming in were about specific conditions that when we were looking at them, we were just like, oh, that requires like a whole topic in and of itself. Otherwise, I feel like we wouldn't do those topics as much justice. So some of them we'll touch on today, but then, like we said, we would go into them, in more detail later.
Because there's so much to talk about with them. For each one, there's treatment itself, diagnosis, of course,
symptoms,
dietary changes, maybe some medicine type changes, or working with Western medicine, et cetera, et cetera. So very complicated.
Right. And I want listeners to feel like that. I don't want to turn off the podcast today if you don't have a uterus. I feel like, well, I know you won't turn it off, but to our listeners, don't shut the podcast off because you don't have a uterus. I feel like someone that you love may have a uterus, and what we're going to share today may help that person. Yeah. So,
and I've had cases like that where people just weren't aware, and through other people discussing it, suddenly they were like, "Oh, wow, I think you can help my friend."
Right.
That's a great thing.
Exactly. Yeah. So today we'll just delve into some of the easier things. And one of the quotes that I found when I was scrolling through Instagram, as I do so often, was from Sally Ride. And she was a female American astronaut in space. And she's quoted as saying, I remember the engineers trying to decide how many tampons should fly on a 1-week flight. They asked, is 100 the right number? She said, no, that would not be the right number. So that's why I feel like I like for there to start being more open conversations about what goes on so that people aren't asking if 100 tampons need to go on a 1-week flight. Into
So that begs the question: is what is the right number? Callers, please enter your guesses.
If you're spot on, you'll win a prize.
Spot on. I see what you did there. So, but that's a really important part of this whole discussion, I think, in that men and women have a skewed sense of what is. What is a period like? What's correct? What's incorrect? What should you expect, or what should you not live with?
Right. When there's a scene in the movie Blended, I don't know if you've ever seen the movie, where Adam Sandler and Drew Barrymore are in like a CVS type store or whatever, and he's going to buy pads for his daughter. And he's just like staring at it, and he's, talking about the different names and stuff. And he's got a box, and she comes over and she's like, is this for your daughter? And he says, yes. And she's like, these are for, he says, I think her friend is visiting, and she says, these are for a much bigger friend staying in a much bigger room. It's just like, but it's true. So that's why I felt like, let's talk about, what is normal and what's not normal. Because if you think that, like some people who are listening may think what's going on is normal and it's actually not, and that skewed sense doesn't necessarily happen for someone who doesn't have a uterus. Someone who has a uterus might have that skewed sense of what's normal.
Right. I mean, I've actually had patients say to me, when I ask them a question, say, do you have headaches? And the answer to that question should really be rarely.
Or no.
Or no. It's a preferred answer. And this young woman said, oh, normal. And I said, and her mom was with her, and I said, well, what's normal? And she said, no, it's like once a week. It used to be once a month. And right there, you can see a pattern.
Right.
And I said, okay, we're going to work on that. In addition to the shin splints that brought her here, she was a field hockey player, and she was in a tournament. They were really wanted to. The focus was more on the sports, right?
Right.
And so I said, all right, we're going to work on both. And you come back if you have more headaches.
Right.
And they were gone. And I called, I checked up with her, and we cleared that. And she would have gone right into adulthood having headaches on a regular basis, and thinking that was perfectly normal.
Yeah.
And maybe other complications down the line.
Right.
This is really just a flag for us as acupuncturists to treat that, knowing that there's some other underlying issue, which I'll let you get into.
So some of the basics that we figured we would cover today in terms of gynecology: obviously menstruation, what's normal, what's not normal, painful, irregular, absence of. We'll touch a little bit on fertility, pregnancy, menopause, some of the pathologies, which usually have a major pain component, things like endometriosis, PCOS or polycystic ovarian syndrome, ovarian cysts, fibroids, adenomyosis, a little bit on cancers of the reproductive organs. Again, most of these that I'm listing in the pathologies, I feel we're going to have to touch on as a whole thing and make it a whole episode. Again, you may not have this, but someone you love may have it, and this will help you with them. Some breast abnormalities, maybe if we can get to it, some scarring. That painful intercourse is a component of some of these things. So it is going to be kind of broad today. Like I said, some of the questions that we got, I felt like, we're just going to have to answer some of these on an entire episode.
Sure.
So if you were someone who sent in a question, I apologize if it doesn't fully get answered today.
But that will help us maybe pick some of the bigger topics, the ones that are more important for people. We'll do them first.
Right.
And we'll pick and choose as we go.
Right.
So let's talk about what a normal menstrual cycle is like.
Right. So normal, they say, should start around age 14. Sometimes kids can get their period as early as 8, sometimes as late as 18. I feel like if you haven't gotten it by the time you're 16, you could, you should be looking into why that's not happening. And it could be things like not enough body fat, hormonal imbalances. But I do feel like it should get looked at that point. And if you look at the history of, because some people say, well, 8 is so early and it's getting younger and younger. If you really do research and start reading, it ebbs and flows. There have been periods in time of history long ago where it was as early as 8. So it's not like it's this new phenomenon that it's environmental factors that are making it younger and younger. Not that they can't contribute.
Sure.
But that, it does change over time. And again, when we say normal in quotations, 28 to 32 days, we like to say there should be nothing that interrupts life other than changing the sanitary pad, tampon, or Diva cup. And that there should be very little pain. It should be like maybe just a little twinge. You shouldn't have to take ibuprofen, and we term them NSAIDs. You shouldn't have to take that stuff on a regular basis to get through having your period every month. And that regular normal every 28 to 32 days doesn't necessarily happen that first year. I feel like that first year is sometimes about the body trying to regulate itself, and sometimes even into the first couple of years. It doesn't always go right into being that regular every 28 to 32 days. Normal amount of blood loss should be between, they say, 30 and 40 to 60 milliliters. So normal would be changing whatever you're using, a pad, Diva cup, tampon, about every 4 hours, although they say the average is most will change every 6 hours. Not normal then is wearing a thicker pad, like something that you would wear overnight, and it soaks through in 1 to 2 hours. That's too much. And it shouldn't be, wearing a tampon and a pad because you're going to soak through the tampon before you can even get to change it. Yep. You shouldn't be soaking through your clothing. And like my story is that as a teen, I was wearing 2 sanitary napkins and thought that was normal. So I think that's probably what, drew me into the aspect of treating gynecology, because I had such a not normal gynecological history myself. And I feel like, there's this aspect of where, made to feel like it's not normal to talk about what's going on in our bodies. And that I'd like to normalize talking about periods a little more and having it not be this taboo topic. So then when things aren't normal, a lot of what Western medicine does is mask what's going on with pain pills. Or, when you see a doctor, I think this PMS culture has made us think that PMS is normal, and it's not. Like we repeatedly, I think, as acupuncture practitioners, our mantra is like, period pain is not normal, period. Like we can't say it enough because it's not, that message doesn't seem to get through yet. So that's why I feel like for me, at least, I'm kind of repeating that all the time. And I find a lot of, when I'm doing research on the things that are main concerns when it comes to gynecology, a lot of people feel like their issues are dismissed and that they're not properly addressed. And I feel like we do take the time to try and hear all of those concerns when someone is coming in. Again, it's, when you had said before, it's, you spend, what was it?
5 minutes.
Waiting in our office, and you spend a half an hour with us and
talking and
Right.
having questions answered and things like that.
Right.
And then in a typical doctor's office, you wait the half hour, you get 5 minutes.
Get 5 minutes of their time.
And they really don't have no time, like you're saying, to talk about this pain. Well, we have this for you. Let me write you a script for
Right.
prescription strength ibuprofen or
Right.
first-hand experience. I've had that.
Yeah, I mean, it's definitely not just gynecological issues.
Right.
It's other issues too, where it's just, again, it's the Band-Aid, and we're taught to get to the root of what the problem is, so that then when things are not normal, the goal is to try and get it as close to normal as possible. And I think it goes back to, normalizing it starts, I could remember when I was in elementary school, they had the talk, the girls and the boys got separated and they gave you the talk. And I think you were sort of made to feel like you had to hide the fact that this was going on. And it was, you felt kind of gross and dirty about it afterwards. It's this gross thing. And, it shouldn't be. It's part of life. And
all words that are euphemisms or
ant
very
flow and
indirect descriptions
on the rag, not good terms, right?
Right.
So of course, us as acupuncturists, I feel like the painful period is one of the things that that's where a lot of people will start. So we again, painful periods are not normal. There's a saying. And this goes not just for gynecological disorders, where they say where there is no free flow, there is pain. If there is free flow, there is no pain. So something isn't working right, and that's part of our goal is to, with our needles, with our herbs. Again, you shouldn't have to take pain medication on a regular basis, whether it's over the counter or prescription, to function when it's that time of the month. It's like there's this mechanism of how the body should be functioning that's out of sync. Like in our first podcast when we talked about that whole basis of yin and yang and one being within each other, something in that image of yin and yang is out of balance, and we're working to get it back to balance. And it doesn't always just show up there. It can be showing up in other areas of their life. Like you said, with the headache, and things that go along with it. Pain before, pain during, and pain after mean different things. And in Western medicine, it's just take this pill. Oh, you have pain before? Take this pill before. You have pain during? Take this one. And it's the same pill no matter what. And it's not addressing why the pain is there. And when we talked about how, we're treating stuff from the perspective of the elements, and thinking of them being out of alignment, the three main ones usually when it comes to gynecological concerns are the liver, the spleen, and the kidney. And I feel especially like with the liver and the kidney, the liver and the spleen, especially the emotions that go along with that, the anger that comes along with the liver and the worry that comes along with the spleen. You see that a lot in patients who have pain. Like it's the underlying. And I try and describe to patients, I'm not always so great at it being quite so poetic as I think some of the classics were, but I feel like the liver, of course, is the main one that we treat, the main element that seems to go awry and affect the other ones. And I always say it's like the soda bottle that is like you shook it up and I handed it to you and then you open it and it explodes. So we're trying to let the bubbles in the soda bottle calm down. And again, that pain at different parts of it mean different things, different things, we're treating different parts
they give
of
us
it.
different indicators of what to treat, what's going wrong, what the pathology is.
Right. I find that if people are having more pain afterwards, they've lost all this blood, that they tend to be a little bit more deficient. They're exhausted afterwards. And the pain leading up to it is that I'm such a tense person and I need to relax.
I have a comment about the pain medications. It's a bit of a story, actually. And this goes back to our discussion about relative ignorance of body awareness and things like that. Is when we were kids, we'd see the bottle of Midol in the medicine cabinet. So do you know what it is? Is it just an analgesic?
I think it's just ibuprofen.
Okay.
I think it's it's just a fancier bottling for ibuprofen.
Right. And of course, the joke amongst boys was, should we take one? If you take one, will you get a period? It just, really, it's funny, but it underscores the ignorance that we all have as, 13, 14-year-olds, 15-year-olds, seeing feminine products in the bathroom as boys and being like, what is that? What's it for? I don't know. Don't touch it.
So this is what's funny in my house. So I have 2 boys and a girl, and my daughter won't even tell me when she, and I'm like, but but this is my thing.
Right.
Like, this is my thing. You should be able to you should be able to walk in the kitchen in the middle of the day and be like, I need pads. and that's just like, that is not happening in my house at
Not with
all.
her.
I have to hide bringing the bag into the house, and I have to sneak it under which I just think is so funny, because I'm like, but this is my area. How did I get a kid who's not like, I thought,
This is my blood.
yes, no. I think she'd rather have somebody else less embarrassing, less,
I
you know.
think so. That's age appropriate, I
someday,
think, for
yeah.
kids. They don't want you to know about that stuff.
No. So, and some of the things that happen with pain, I find foods can impact that. So again, you know, we've said this on other episodes. Sugar is the root of all evil. It tastes so good, but it really is the root of all evil. So in you know, Asian medicine, it affects the spleen, which then, you know, kind of counteracts on the liver, and it's this vicious cycle. But I mean, I know it tastes good. Like, you don't have to tell me. Tastes amazing. And I find certain patterns, like overly cold foods, when there's that, you know, a more constricting pain, or too many hot foods can move the blood a little bit too much. So, you know, we have to sit down with each person and go, okay, well, which things do you need to shift and adjust so that it makes things work a little bit better? And again, you know, when we talk about how long it takes to change something, I really feel like the magic number is the 3-month mark when it comes to changing that pain cycle. So like, if someone comes to see me and they're in the middle of their cycle, they might not see drastic changes, but the pain should at least lessen that first time. And this is different from if they have some of the other pathologies that we're going to talk about a little bit later. I feel like some of those pathologies, it's really like 3 months before you really start seeing a difference, and sometimes 6 months, like the things like endo and PCOS. It takes a lot more change over time to regulate those. But when it's, you know, a more simple pain where somebody's like, yeah, I've always taken the Midol or the, you know, ibuprofen, that we can usually see a difference, you know, within 2 to 3 cycles. And, you know, maybe they'll still come in for maintenance once in a while, but those are like the easier things to treat.
Yeah. Like, some of my patients will tell me that they'll take a little bit of ibuprofen or something, or they won't take any at all. Or there's a couple who have said, I'll take that and I'm just flat out on the couch. Like, I can't move. I'm almost unconscious, you know, for the better part of a few days.
Right.
So can you explain a little the difference there?
So for them, so is it the cycle itself that's making them exhausted, or the taking something that's making them exhausted?
I think it's the taking of something.
So I almost feel like that goes into, some people are more sensitive when it comes to taking meds. I'm going to use a fibromyalgia patient that I treated for a long period of time, who acupuncture was the only thing that helped her, because every med that they tried to prescribe for her made her feel like crap. So not only did she have this like all over pain from the fibromyalgia, but then she felt it wasn't making her feel better at all.
The cure was worse than the sickness.
Right. So I think that, you know, some people are more sensitive to different meds. Like when they go through a drug disclaimer, when you watch these commercials, I'm like, I don't know. I'm kind of like, maybe I'd be better off being sick than having diarrhea, you know, headaches and nausea and vomiting, and maybe I could die from this drug. Well, okay, what I have isn't going to make me die, so maybe I'll just not take that drug. And I feel like, I remember in school when I took the pharmacology class that they had for, I don't think it was the Rutgers one, I think it was when I was at PCOM, where the instructor was a pharmacist and an acupuncturist. And one of the things that he said is that the side effects of a drug are not just side effects. Those are just other effects. Yeah. Some of them are desirable and some of them are not desirable. Right. So like there are meds that, like I was sharing with a patient. So one of the treatments for endometriosis for the pain is to prescribe Percocet. So if I were to take a whole Percocet, I'm in a coma. Like I can't get off the couch. But if I cut it in half, oh my God, I can clean my whole house. I don't have pain. I was like, I imagine it's what someone who's on speed is on. And why would the half dose be so different from the whole dose? So again, I think it goes into the constitution of that patient and like why, certain conditions affect someone, and something could be said for pain tolerance. Like I think that people who have had long-standing problems, like that when they have things like PCOS and endometriosis and fibroids, I don't know if the pain tolerance just gets, like you just tolerate more of it because it's just there and you teach yourself to kind of numb it out.
Yeah.
So,
And your brain does shut down some pain after a
Yeah.
while. It's a signaling system.
yeah. I know when I had my last surgery, I was trying not to keep pressing like the pain button, and someone came in to do like, how they have to just, it's time for us to do your blood pressure and whatever. And I was like, listen, I need you to just give me 5 minutes so I can breathe through this cycle of pain. Like I knew it would pass and I didn't want to press the pain button. And I was like basically almost getting into a fight with with her.
Yep.
But I knew that if I breathed through it, I wouldn't need, so there, there's that aspect of it, of teaching yourself the, more relaxing breathing. And I do that with some patients as well. Because I think that also takes care of that. If their pattern is that like livery constricted person, learning better breathing, I think can help a lot. So yeah, I feel like that's one of the more common things is to smooth that out. And I feel like for me, my magic number is if I've been seeing someone like 4 to 8 treatments, so that like, let's say they did twice a week for a month, and there was absolutely nothing that changed, I want to send them for other testing to see what else is going on. I mean, it very rarely happens that someone says nothing has changed at all. I think in the entire, and it wasn't a gynecological patient. In the years that I've been practicing, I had maybe one person who every week would come in and just be like, no, nothing is, I'm like, you're not even less stressed. Like, are you relaxing more? No.
Do you know?
Nothing is different. I was like, okay, why don't you come in when you're actually in pain then? Like, text me, I'll do an emergency appointment and I'll come in. And I never heard from him again.
Right. Yep.
So, and those things that I'm looking for, like I want them to have ultrasound and blood work to see if they have things like fibroids, cyst, PCOS, endo, because I feel like that might change the treatment plan. It might change what herbs I'm putting them on. And I don't necessarily need that testing. But yeah, if somebody has said to me that they don't feel anything different, I definitely want to have, other testing just to see what's going on.
Sure.
And then, aside from the pain, I think another thing that can happen is, the cycle can be irregular. And we usually talk about so regularly irregular, they say really isn't irregular. That's just that person's pattern. So if it's early, like let's say this person has a cycle and it's 24 days, but it's happening 24 days consistently, that's not really irregular. It's a shortened cycle. Now, we don't call that normal. We want to extend it a little. One, because no one wants to have their period every 21 to 24 days. It's so close together. Or if it's consistently late and regularly late, then it's just late. It's just, every 40 days. And there can be other things that are going on that are making it late. But to me, when I have a patient in front of me and it's irregular, they tell me, well, it was 24 days this month and it was 40 days the next month. And then it was 40 days again, but then it was 20, so there's no real pattern to it. It's just mysterious. They don't know what and how to plan their life. And I feel like, acupuncture and herbs work so well to get that pattern back on track. And again, it's just that consistency of treatment of like, it might take, 2 to 3 months of regular treatment, but it usually gets back on track. So yeah, that would be, it should come around the same time. And there are events that can happen. There's a really great book that I read years ago, and I have the very horrific habit of lending people books. I now write my name in front of all my books so that if somebody, so there's a book called Taking Charge of Your Fertility. I think Tony Wenchler is I never repurchased it. I think I have this fantasy life where people will return the books that I've lent out. The Web That Has No Weaver, I think I said that before, that's another one. But she talks about how a traumatic event can change it. So let's say you've lost a loved one, or you were traveling. Things like that can give you a one-off cycle. If it just happens once, I don't consider that to be irregular. I feel like that's just hey, something stressful happened. I think in her book she talked about a patient of hers either having, like, there was an earthquake, and the earthquake made her period come like 3 weeks later than it should have, just from the trauma of being, awoken in the middle of the night from this, from the earthquake. So yeah, it's the specific pattern that we look to see, is it really irregular or is it not irregular? And then when it's, again, regularly irregular, like either consistently early or consistently late, we're looking to lengthen the cycle or shorten the cycle so that it's, around the right time. And again, when they talk about that normal window, if somebody's getting it every 35 days, I'm probably not going to mess with it. If it's 40 days, then I'm definitely trying to regulate it a little bit more. And then we can have, the absence of it altogether. And when I think of it, someone not getting their period, I'm not thinking of, they've just never gotten it yet, or, like there are cases of going into menopause early. Like when we talk about menopause, they say 49 is like the 7 sevens is when you should, the blood should stop and be nourishing other parts of the body. This is like unexplained, suddenly stopped. I looked at things like the diet. Did you change something in your diet? I've seen it happen. Actually, when I was still at PCOM as an intern, one of my first cases was someone who had had a baby. She was very thin. And when you have a baby, we talk about it takes a lot of blood, and I forget the phrasing, but they kind of talk about it like the baby is a parasite because it's living off of you. It's a parasitic relationship. It takes all of this chi and blood and energy, and you're kind of not left with, much. A lot after. Yeah. So then if you nurse, that's still taking chi and blood and energy. Right. And sometimes the cycle doesn't come back right away. So I want to say, and again, I was a student, so it probably took me 6 months to get her to have her period again. And I think in the beginning, because she was vegetarian, we were very careful about what herbs, because she didn't want anything that had
animal
products. And probably 2 months into it, when she didn't start menstruating again, and she wanted to have another baby, that was why it was so urgent for her. I was like, okay, there's 2 ways we can do this. It's going to take you 6 months if we do it with these herbs, or you can start adding a little bit of meat back into your diet, because blood makes blood. And I think it was probably at the 4-month mark that she got her period. We regulated it, and I think within 6 or 8 months she ended up getting pregnant. So for me, I was like, that's again why I was like so in love with gynecology, because it was in school. And so an illness can interfere with that postpartum. I expect that when my patients are nursing, that they're not going to get it for a period of time. They say if you're consistently nursing and nursing at night, the cycle should not come back for a while. And I think that the body needs time to heal. Like for me, I think that they said that if you nursed for a year, your body still needed a whole year from the time you stopped nursing to replenish the chi and blood that it takes to make the baby and nurse. So not that everybody waits that long, but that's a good amount of time. So usually,
What about competitive sports?
Yeah, I think that definitely can be part of it. And that goes into the body fat aspect of it. That I could remember people asking me like, I think my child is going to get their period soon. And it was like, okay, the things to look for are like the weight being over 90 pounds and hair, pubic hair under the arms, the weight aspect of it. and that would indicate that it might be happening soon. But I feel like when the body fat drops to a certain amount, it does. And that's when you see like the competitive sports are a lot of times dancers who are super, super thin, that they don't have it.
Right.
And if they're not going to change their diet, it might not return for a while, or they don't get it until they're, 18, 19, when they stop doing whatever that sport is as much. So I definitely see that happening.
And is that also a category in the absence of menstruation where you're in adulthood, they have gone through menarche, but then they lose it because of, say, marathon running?
Yeah. See, I feel like if they've had at least a few cycles, or even at one cycle, to me that's absence of, and we're trying to bring it back. And I mean, there are certain hormones that they can have their doctor check for if they're, they have, let's say, a little too much testosterone. I think, oh my gosh, I can't think of the other hormone. There's another hormone that I have sometimes to check for that can be out of whack, that could be impacting whether or not they're getting a cycle. And that, so I put that in the absence category. And then fertility, I feel like so when it comes to fertility, and I feel like we were having this conversation in the class that I was in yesterday, I get a lot of I call them the cold calls. I'm having an IVF embryo transfer tomorrow.
Right.
And I heard that acupuncture can help. So I want to come in and I'm like, okay, first of all, I'm like, I don't know that can it hurt? No. Right. Can it help? Maybe. But then if it doesn't, you're going to tell people I tried acupuncture and it doesn't work. Again, with the 3-month thing, when someone is going through fertility, I want to see them for 3 months. Even if they're doing IVF, I feel like you get better numbers of eggs, better quality eggs. Right. They fertilize better, and you have more ready for transfer than if you call me up the day of and you're like, we had one lone embryo. And I'm like, yes, I want to help you. But I end up, for me, saying, I refer them to someone else, because I don't want them to say that they came to me for acupuncture and it didn't work. Well, it didn't work because you called me the day of. Like, called
me 3 months too late.
Yeah, I want to be nurturing those potential eggs when, before they do the retrieval and take the eggs out. And some of the conditions that, we already mentioned can contribute to the aspect of fertility. Like if there's a shortened cycle, their window of when they're trying could be wrong. So sometimes just extending the cycle out so that the second half of the cycle is a little longer, and it's called the progesterone phase, so that they're getting that phase is a little longer and the embryo has a better chance to implant. But again, the window that they're trying could be wrong. I mean, they could be trying too early, they could be trying too late, because that's another misconception, is that ovulation occurs at 14 days.
Right.
It's not necessarily.
Right, sure.
And also if the cycle is too long. So like for me, one of the things that, and I did go through fertility treatment. So at the onset of it, one of the things that I was doing was charting. And, because I knew how to chart, we'd had all these medical classes. And I could see, so when someone charts, they take their temperature first thing in the morning, and they draw it on this little chart that you have in front of you. And mine looked like a sawtooth, and it was 40 days long, and it was sawtooth the whole time. And it shouldn't look like a sawtooth. Right. It should be flat. It should go up and plateau and then drop down when you get. So what happens is, in a case like that, there's this anovulatory bleeding. You're bleeding, but you're not ovulating. So I had like 6 months of charts, and I was like, okay, this is insane. And I called the doctor, and because I was I was like 26 at the time. They're like, no, you try for a year. And I was like, okay, can I come in and I'm going to show you my chart? And I want you to tell me when I should be trying, because I must not be trying at the right time.
Right.
And I brought in the chart, and the doctor was like, oh, you're not ovulating. And I'm like, yeah, I knew I wasn't ovulating, but I clearly needed to show you on a piece of paper. And in my case, it was because of endometriosis. There was just so much estrogen, and I was never having that
Right.
second, the second half of the
Right.
phase. And so, we look for what underlying conditions. Again, PCOS, endometriosis. Age can factor in. That can affect the egg quality. And there are studies that are showing that when patients do choose to do acupuncture, that egg quality and sperm quality both improve. And we kind of talked about that sometimes with fertility, it's a little harder, that while we all prefer that both people come in, we can't always get both people to come in. And that, one of my things that I want people to remember is it takes both of you. And the whole idea of the baby being in the best state of health comes from the parents both being like in the best state of health. Right. So if both parents are getting acupuncture, you're giving that baby the best prenatal chi that they can get versus if only one of you is coming. And I mean, certainly people have healthy babies without acupuncture, but I feel like it's such a great thing to add ahead of time and keep you healthy. And I always try and tell people and get the message out that, even if you don't think you're going to have fertility problems, it's not a bad idea to start acupuncture ahead of time and get comfortable with it and take care of yourself. Some patients come in and have secondary infertility, so they have one child and they're having trouble having the second, and different things can happen there. I've had a couple of cases where the way that the placenta came off the uterine wall caused a scar tissue, and it kind of smooths it out. And then they were not able to, even with acupuncture, because that, the way that scarring is.
Yeah, there's not going to be any
there wasn't
there.
improvement with that.
If there's one thing I could stress to a couple trying to conceive is that the male check his ego and get checked.
Yeah.
Because multiple times I've seen this happen where no, it's not me. I'm fine. I have a child from another relationship, or whatever excuse you have. Appreciate your partner enough to take the time and get checked out.
Right.
I don't know how many times women have gone a year, like you're describing,
and she's not even the problem.
And it turns out.
Yeah.
And then the other, a little more specifically about that is a couple things that I learned back in 2006 when I took a class that people don't think about is chefs are at high risk for low motility rates, right?
Because the oven height.
Because they stand in front of this heat all day long, and that's not good.
Right.
A laptop is another one.
Yes.
Right? People don't think about this. They say, oh, well, I put a pillow on it or something. Get up, move around.
Right. The too tight underwear.
Little things like that,
Right.
people don't pay attention to. And
no hot tubs and saunas.
Right.
Yeah.
Like I said, the ego thing, it's in the way. There's nothing wrong with me. I just had a case where it was determined, the motility was, or the count was like drastically way down, and the motility was almost non-existent, and he still wanted to get a second opinion on that. Like they didn't even bother doing the follow-on test from there.
Just wanted to go somewhere else entirely.
Yeah. So,
Yeah.
But that's the path they're on.
Right.
And hopefully they'll get what they want.
Yeah.
But one of the
I've seen that actually, like you were saying, when they have a child with someone else. And there's, that was actually one of the tests one of the fertility tests that they do is a postcoital test where you have intercourse and then they analyze what's there afterwards. And sometimes there's, compatibility issues where, then an intrauterine insemination can bypass the fact that the sperm are not getting to where they need to go.
Right.
And I feel like it does help with all those assisted reproductive techniques. I just feel like it only helps, but I just don't like waiting until that last minute on the day of. I feel like I want to know that I nurtured, like I said, I nurtured that embryo from when your cycle started, and
It's way up in the follicle.
and yes, while you were a thought in your parents' mind, I was there. One of the things I was going to say is that having gone through IVF, I never experienced any of like the side effects that they tell you that you have to like, oh, the crankiness and the moodiness. But I had been going for acupuncture the entire time. And I've noticed that with my patients as well. I have a couple that I worked with, and they're due at the end of this year. And, you know, she missed like 1 or 2 treatments, and her kids were like, have you not seen Dr. Stephanie, because you are super cranky. And this is while they were going through the process of like, you know, on the meds to stimulate for the egg retrieval and everything. So she came in and told me, and I just thought I love the fact that like your kids know that you need to see me even, and that they can tell that you've missed an appointment with me. So you know, and again, fertility is another one of those things that I feel like we're probably going to have to devote an entire episode to. So I don't want anybody to
probably
feel
more than one.
Yeah,
really.
I don't want anybody to feel like we glossed over it, but you know, there's
back to your story about the family. Is I will describe acupuncture to some people as sensitivity training.
okay.
Retraining your body or retraining you to become familiar with how you feel.
Yes.
And so often people will say, well, I didn't feel so good the other night, so I drank more water and I went to bed early, and everyone else in the office is sick, but I'm not, because they came to me and they were a little more mindful and taking a little better care of themselves, feeling that little bit of something coming on,
right.
and they're all the better for it. So
Yes.
they're becoming more tuned in.
Yeah.
Just like the kids are being tuned to mom's situation.
Exactly. So, so another issue that comes up is excessive menstruation, which I define as the 2 different ways. The frequent changing of the pads more than every couple of hours, and it's, you know, like a heavier, not just changing it because you feel like changing it. They may have clots. I like to know the size of the clots, the color of the clots, the color of the blood, all that stuff, no matter what's going on.
Well, everything is an indication to you.
Right.
That's
what I need to
powerful
treat.
information, right?
Yeah,
whether it's
exactly.
rusty colored or bright.
Yes.
You know, that tells you.
Exactly. All different things that are going on. And the other thing is that I consider excessive. Maybe they're bleeding a normal amount, but too many days. Like it really should not go beyond 7 days. If you're bleeding more than that, I use Moxa to slow it. If it keeps happening, I want to look to things like, do they have fibroids? Again, endometriosis, do they have adenomyosis? And while they're going through trying to figure out what other things are going on, if I can't get the bleeding to stop, adding foods to replenish the lost blood, like beets, black beans, red meat, bone broth. And I'm not saying, I don't want anybody who doesn't eat meat to get upset that I'm saying that. I work with the patient that's in front of me. If that's not a food choice, you know, there's other herbs and things that I can do to try and replenish that. And again, I'm always cautious about making sure that there isn't something that needs Western intervention. I think a lot of times we just think, oh, you know, I'll put that off to the side and it'll just go away. And if it doesn't, I want to make sure that patients are, and again, if I can't treat something within that 2 to 3 month time, I want to make sure that they're, finding other ways to stop it. Then we have the scanty menstruation, what I like to call the little pink period. And my mentor always said that it's the little pink period. So this is where the patient comes in and they tell me, I wear a panty liner all day long and that's all I need. And I'm like, oh, what is that? Like, that's nothing. And I guess, if you're young, that probably feels like a great thing to have this freedom of not having. But I feel like this one comes up as an issue with fertility stuff because, when it comes to wanting, if someone wants to have a baby, I feel like they need this thick, lush lining, not the little pink period.
Sure.
And I feel like the blood is thin, it's pale, it's watery, and they'll tell me they only, I wear a liner for like 2 days and that's it. And again, looking to see if there's something else that's wrong. I've had patients tell me that they've had testing done and they may have, polyps blocking, and then the blood can't come out, and then, the body will resorb it, but that's not a good thing. We want the blood to come out. I actually, when I was first practicing, had a patient that I was treating for migraines, and she had that little pink period. And she was getting all these migraines, and so she, more blood deficient. And, we built it up. She was having a more normal period, and the migraines weren't bad at all. And she came in one day and she had this horrible migraine. And I'm thinking, but we were doing so good. And like, what went wrong and what changed? And she had like a little bruise in the crux of her elbow. And I thought, oh, she must have had blood work done. So I feel like when I talk about people being blood deficient, they'll say, but I had my blood work done and I'm not anemic. And I think we pick it up before it gets to that point where it's, on the lower side of things, maybe on the cusp. Right. So she says, oh, I didn't have blood work done. I donated blood. And for me, it was this moment of, I spent the last few months building that blood. That's like I had her on herbs and I had her eating all these foods, and I was like, that's my blood. It's not yours to donate. But it was a lesson for me because as a new practitioner, it never occurred to me. And I've been a blood donor. It never occurred to me to say to someone who I was building blood, don't donate blood. Like it just wasn't. Right. But now,
you should not be donating blood.
Right. Don't donate blood. We're building this up. This is yours. I know it's a nice gesture, but we're not giving it away. So that's another, and again, that goes back to the foods where if someone is excessively bleeding, the beets, the black beans, red meat, bone broth. When it comes to pregnancy,
to your point about doing an intake and trying to understand how deficient they may be, right? Detecting this early anemia,
right?
How do you handle when someone is either on the pill or they have like that Morello thing?
So
they'll just say to me, "Oh, I don't have a period."
I don't have a period. Yeah.
So now all this diagnostic information is gone. It's if it's there at all, it's skewed
right
by this alternative hormone therapy.
So I look to what it was like before.
Yeah.
What are you on the pill because of birth control? Or were you put on it because of the pain to regulate it? And what was it like beforehand? Because I tend to feel like they come off and that problem is still going to be there. Sure. Even like...
Because it's another medication that masks symptoms.
It's a chemical cycle and it's not, like with endometriosis, that is one of the treatments that they do for it. So I had been on it at periods of time, and whenever I went off, right back to where I was before. And I mean, I think the theory is that it puts the endo at bay, but I don't think it really does. Right. I mean, maybe in some cases, if someone is mild, like I had stage 4 endometriosis, the pill wasn't stopping what was going on. So I looked to what it was like beforehand, why they went on it. Because it's not indicative of a real cycle at all. To me, it's like a pseudo cycle. Right. And
so
even
you don't get to ask all those questions.
No, I still
powerful,
ask them,
meaningful questions.
But I even ask them if someone has gone through menopause. Like if someone is new to me and they've gone through menopause, a lot of times on the intake form, that's how they'll fill it out. Like, no, I went through menopause, and I'm like, no, I still want to know what it was like because there's that general thing of this is what their constitution is like. And I feel like all that juicy information is still so important. So even if they try and gloss over it and oh no, I'm not going to talk about that. And I'm like, oh no,
imagine
you are.
Imagine them talking about it with a man. There's even less, interest
in
sharing that information.
But again, that goes into the, I want to normalize periods because we should be, I mean, I remember years ago.
Fine, everything's fine. Fine.
I was at a friend's house and, talking to her mother-in-law about endometriosis, and hers had developed into endometrial cancer and she had to have a hysterectomy. And I was just inquiring and asking questions, and she later emailed me and was like, can we not talk about that kind of stuff when my husband is in the room? And I was like, you have a daughter, so you should be making him comfortable with talking about those types of things. Like, your daughter should not feel like she can't talk to both of you about what's going on. So again, you know, I realize that my expectations might not be super realistic, but I'd like to normalize periods so that we can all talk about them in a room full of mixed company, entire populations. So pregnancy, I feel like there is some practitioners don't want to treat pregnancy. I love treating pregnancy. I feel like my moms that have gotten acupuncture usually report that their births go very smoothly, that there's less need for things like epidurals and pain, or just maybe a little bit of pain medication to get through, you know, if they're taking a little bit longer to dilate. I know for me, I had that hyperemesis gravidarum, which is that excessive nausea and vomiting with my pregnancies. Yeah. And, you know, while I did have to take medication for it because I was losing weight, I do think it would have been worse if I didn't do acupuncture. Right. I you know, have patients who, when they have a breech baby, if they've been getting treated by me all along, I do the moxa on the little toe. And I do that even just as a birth prep. I feel like that, not just the breech positioning, I love the moxa on the little toe for just getting them ready. And I feel like, while this is a touchy subject, and again, I feel like when I go through the list, as I was even prepping for this, I was like, yeah, I have this wrong with me. I have this wrong with me. I was like, I am a walking episode of our podcast. I feel like acupuncture helped me get through the miscarriages that I had, because it's emotionally traumatic to the body, it's physically traumatic to the body, and you need to recover in both ways. And I feel like without it, it wouldn't have gotten me through that. So it's not the more fun, obviously not the more fun aspect of treating, you know, pregnancy and miscarriage, but I feel like if you can be there for those patients, it really helps them to heal from that and feel like they have someone on their side. And, you know, sometimes patients are crying in the room, and I've cried with my patients, and happens. It's just part of the, you know. But I feel like when I was in school, did they tell you, don't ever cry with a patient?
I don't recall. I
feel like a couple times they were like, oh, you can't cry with patients. And I'm like, yeah, sometimes you just have to. I just feel like I want them to know I'm human. I don't want to ever walk out of the room and have them be like, well, I just told them something horrific and she just didn't even care. Right. So,
one thing I wanted to say about pregnancy was that there are a number of women out there who think that once we help them get pregnant, now we need to stop doing the acupuncture.
Right.
Because it could induce labor, even though, you know, they're a week. You know, they've been pregnant for 5 weeks, 6 weeks,
right,
something like that. And I've had people stop and then come afterwards for postpartum.
Yeah.
Or I've had people say, "Oh, I love this. I want to keep doing it. Can we do it?" Like, oh yeah, there's just a few points that we don't use.
Yeah.
And there's plenty of other points.
Right.
That we can use.
No, I feel like it's a wonderful thing to do.
Yeah, especially for, you know, different problems, back pain.
Right.
PUPS.
Yep.
You know, you can change a woman's life.
Yeah.
With that, I had one of my patients. First I helped her quit smoking, then I helped her get pregnant, and then she had the PUPS, and was like, you know, the doctors would tell her that's going to go away after you deliver, and she's like, you got to be kidding me. My life is like agony right now.
Right.
And a few treatments, and she was like, oh my God, I can't believe what this.
That they
do.
were, telling me to wait.
You know, or that it's gone.
Right.
So.
Yeah. Also, I feel like and I didn't really get into this because, again, pregnancy and postpartum, again, could be a whole, but I feel, and it's harder to have, sometimes new moms can't get in.
Sure.
But, you know, even with like helping with milk production and lactation and milk supply, and I've helped patients, you know, who unsuccessfully, you know, short period of time breastfed the first one, and then with acupuncture more successfully breastfed with like their next child. So, it's just kind of like, I'm trying to make this like the chain of occurrence. So I figured menopause could fit in here.
Sure.
In terms of treatment for menopause, I feel like the chief complaint for people is the hot flashes and the night sweats, soaking through night sweats. And, it's a shift. It's a normal occurrence that I feel is talked about much more poetically in Asian medicine, that they talk about that when it's happening, it's so that, the blood is no longer flowing so that it can go to other things and keep you strong and healthy. And you're just kind of looked at like this, not all the time, but I feel like Western medicine just doesn't speak about it as poetically and just kind of,
Sure.
You're the old gray-haired woman now
Right.
versus
Crone.
Yeah, the crone. Where it's in Asian medicine, it's more like the wise old crone, like the person that you go to for advice. And I feel like the period can be somewhat irregular while they're going through that. And I always like my rule of thumb that I tell patients is that they're done with the cycle when they haven't had it for a year. And a lot of times they'll go like 6 months and then it'll come back and they're like, it came back. And I'm like, oh, we're starting the clock all over
Right.
again. They're like, well, do we have to count? I'm like, no, it has to be a year from, when that happens. And, the average age is 49. I have seen some, people go through it much earlier than that.
Sure.
Some people go through it much later. I feel like my mom went through like very, very late. And that in Asian medicine, it's the 7/7. So that's where they come up with the 49.
The other way I heard that described was that, men tend to be yang and women tend to be yin, right? And as we age, the yang fades. And in a woman, the yang can
yin.
fade, but the yin is still there.
Well,
right?
but
And
so
with
there's
what you're saying about blood,
yeah,
right, is now you're not losing it all the time.
Right.
So you're actually, there's no surprise there why women live longer than
well,
men.
so another one that I heard when I was in school was that part of the reason that women live longer is because being able to have that cycle discharges toxins and men don't have that ability. And I know some people were like, well, what if they donate blood? And I'm like, I don't know that it's the same because, it's just looked at differently, but that was another one of the reasons why they live longer. Right. And I mean, we won't even get into some of the other aspects of it where,
Sure.
the essence part of it, we could do that in a whole nother,
another episode.
another episode. So there's foods that I would normally be like, oh, don't have this food, don't have that food. I
Right.
tend to recommend a little bit more cooling foods so that some of that heat kind of comes down a little bit and they can be a little bit more comfortable.
So we're at 8 o'clock.
Okay.
And we do have a couple questions.
Okay.
Do you want to do the questions because they're related to what we've been talking about, or do you want to move into the next?
Well, I don't want to leave out.
And let's do it.
So
We have plenty of time, right?
All right. So I think what we'll do is, because I do want to get the questions
Sure,
in,
sure.
we'll just talk real quick about some of the Western treatments, because obviously, we're using acupuncture, herbs, diet, and those sorts of modalities, lifestyle changes. Western treatments for menstrual irregularities, birth control pills are the big one. And we talked about that, when we both first started, which was around the same time as practitioners, that you saw a lot of fertility cases where women had been on the pill from the time that they were 14 until they were 28. And I don't think that they're maybe not prescribing them for those long periods of time anymore. And maybe the doses and things have
Doses
changed.
have definitely gone down.
So that it's not as harsh on the body. And
Sure.
and I always, while I don't love the fact that it's a chemical cycle, I feel like when someone is on birth control pills because they're using it as birth control pills, I don't encourage them to stop because I feel like no one should have to have a kid that they do not want to have. But when it's to regulate the cycle, I don't want them on it because there's so much that we can do to help that. Western pain management, like we said, the over-the-counter non-steroidal anti-inflammatories, narcotics, pain patches like lidocaine. I remember because my cycles were really severe at a very young age and I vomited So vomiting, that's another thing. Not that that's a big one, but vomiting when you have your period is not normal. You should not be vomiting. That's chi going in the wrong direction. They prescribed, I think it was Anaprox for me, and one of the side effects was vomiting. So what do you think it did? Made me vomit even more. So, and again, it's a Band-Aid. I like to see people, come off of that. And then, tests that I like patients to have just to make sure things are in order is like their routine blood work, checking for anemia, blood cell counts, thyroid, endocrine hormones, the hormones that regulate the cycle, ultrasounds to make sure someone doesn't have cysts or polyps. Although with polyps, a lot of times they have to go in and scope for that. Tests like if there's fertility issues, hysterosalpingogram to see if their tubes are cleared, CT scans, MRIs, and again, like we talked about, sperm analysis for fertility, uterine and endometrial ablation are one of the treatments that they'll use a lot of times for the excessive bleeding.
Sure.
Which usually after that's done, you're having that done, you're not planning on having children after that because the lining doesn't come back. And then, like I said, emphasizing that for us, I usually like to ask a patient to give me 3 months to get them back on track. It's that, and sometimes that first cycle, maybe they'll have a little bit more bleeding, maybe they'll have a little more clotting. It does take a little bit of, tweaking to get that cycle regular. And I add supplements sometimes. I do herbs for my patients. I feel like herbs are a big part of it.
Yep.
And
the big power of that is they're taking them every day.
Yeah.
Right? So instead of coming in
yeah.
once a week or twice a week even, taking it every day is really changing their hormonal profile.
Right. Yeah, so that would be like their homework. And, getting people moving. And like I said, some of these other things that I had mapped out for us to talk about, they're just so complex, like the fibroids and all that stuff, that I really think we'd better serve the audience just talking about all those things on, But the things to look for are like pain that doesn't get resolved, excessive heavy bleeding, increased cramping. Always check with your doctor and make sure that something else isn't wrong. And one of the things that I've been telling my patients, because we can't order tests here in New Jersey, I know some acupuncturists can order different types of blood work, or if we order blood work, it's not covered by the insurance. And I've started telling my patients that if you want a test done, and this is something I wish I knew when I was younger, and your doctor says no, like when I was begging doctors to please check me for endometriosis, and the response that I got over and over was, you're too young to have it. Mm-hmm. So that by the time I got someone who did listen to me 16 years later, I had stage 4 endometriosis and had to have an ovary removed and had to have major surgeries. Ask them to put in your medical chart that you've requested this test and that they've told you no, because now you have a record of it in your chart that you've asked for whatever this test is, and that they didn't give it to you. So, like I said, I have a ton more of things here, but I feel like they each need their own podcast because I don't want to rush through them. So let's check the comments and questions.
Let's see. We have a question from Hillary. In your experience within Western medicine, is adenomyosis overlooked and not treated similarly to endometriosis? Do you treat both conditions differently with acupuncture and herbs? Western medicine seems to dismiss
adenomyosis.
Thank you. With the attitude it is not as bad as endo. Just wondering what your experience have been. Thanks.
So I tend to treat them similarly because they're both looked at as a blood stagnation. I think that they're equally horrific. I think that the adenomyosis, so in my experience, they go hand in hand. Most of the time you have both of them. I guess not always, but a lot of people who have endometriosis have adenomyosis. And I feel like when the adenomyosis comes into play, that the pain is actually worse than when it's just endo by itself. I've been following someone on a social media platform just because she is super, super young, in her early 20s, and has severe endo and adenomyosis, like at her age. Like, I don't think she'll be able to have children. No. She spends a good portion of her time, or spent a good portion, in the emergency room. They've done surgical procedures on her. She'll probably still have to have more. I do feel like the adenomyosis makes it worse. I do feel like acupuncture and herbs can help it, but endo is still one of those things that you are best served by doing both, and finding a really good endo specialist. I feel like not every GYN is an endo specialist, right. And most of them, like, I've seen on different platforms, like, back when I was younger, the theory is that it was like retrograde menstruation, that it backed up into the tubes and went into the abdominal cavity. At one point, it was thought that it was the same tissue that's lining the uterus outside of the uterus. Now they refer to it as endometrial-like tissue, because it's not the endometrial lining. It's a different type of tissue, but they don't know enough about what it is. And they don't know what causes it. They don't have a cure for it. But I feel like Western treatment and acupuncture and herbs can help. And if you're doing acupuncture after the surgical procedures, it tends to be longer in between needing surgeries. Like, it seems to help patients more, right, and not require as frequent surgery.
Right. Yeah, I had a patient who had that and then had a child, and then it came back.
Yeah, that was another misconception. Well, if you just have kids, it'll go away. No. Having children is not a cure for endometriosis. Do not let anyone tell you that.
And PCOS, can you describe that? Spell it out.
So polycystic ovarian syndrome. Right. It's excessive cysts. That's a more hormonal issue going on, where, thyroid hormones often come into play. There tends to be a specific body type. There's excessive hair. The androgen hormones tend to be out of whack, so they're a little bit higher. So again, a lot of times that's going to involve both having, Western treatment and acupuncture and herbs. And I feel like when you do the acupuncture and herbs, it preserves the fertility if the person who has PCOS wants to have children at some point. But that's more, of a hormonal imbalance going on. And again, that's one of those topics that we're going to need a whole episode to cover.
Yeah, you can have a whole season.
Yeah, a whole, season of gynecology.
There you go.
And you're going to hate me by the end of it. You're going to be like, no more uterus crap. He's going to have nightmares of, like, the uterus stuff.
Anything else you want to
So
add?
Was that all of our questions?
That was all for the questions.
No, and like I said, my list of stuff that we have to still cover more in depth are things like fibroids, PCOS,
yep,
endometriosis, adenomyosis,
uterine polyps,
yep,
and your favorite, MTHFR.
So I don't have any patients who have come to me yet who have this, but you know why I think it's funny. So I'm going to say what it is. It's methylene tetrahydrofolate reductase variant, but the initials for it are MTHFR.
And
everyone calls it mother effer, because that's what it looks like. I can't look at that word and not see that. But yeah, so cysts, we'll talk about diagnosis for those things. At some point, I'd like to add in, like, ovarian cancer, breast cancer. I do want to talk a little bit about basics of diet. Again, watching sugar. People are going to hate me.
What's so bad about sugar?
It's like heaven when you're eating it, but it's not. So many things.
I thought you would actually answer my question. Seriously.
No, it causes inflammation.
Yes, it
causes
major
increases
inflammatory.
yes.
Right. And it's in everything.
Yes.
And it's growing it. They're upping levels of it. If you look at ketchup today versus 10, 20, 30 years ago, there's more and more sugar in ketchup.
Yes, in everything.
Yeah, just as an example.
Greasy, fatty foods. Although, I could bathe in olive oil and just be ecstatic.
But it's not a trans fat.
No.
And the trans fats are really the culprits in greasy, fatty, deep fried foods.
So anti-inflammatory diet, I feel like, the American diet has just a lot that it wreaks havoc with. Exercise, I always want my patients to exercise. When I said before about where there is no movement, there is pain. Where there is no pain, there is movement. And when I say exercise, like, listen, I'm not running marathons. I can't run from here to my car. But stretching, getting up and walking around, like when you were saying about having the laptop on your lap, every hour trying to walk around for 5 minutes. If you have a desk job, get up, walk to the bathroom, wash your hands. No one has to know that if you don't have to use the bathroom.
If you have a pet, be like your pet.
Yeah.
Whenever they get up, they stretch.
Yes.
Right. And
moving around.
They want to move around. And there's that need for... I generally
want everybody on a multivitamin, again, because our diet is not the greatest usually. I find most people need vitamin D. They might be borderline, and I find a lot of doctors, when blood work comes back, I'm seeing a lot of patients who are at the threshold of the low end. Vitamin D right now I also feel like is important because they're saying having a normal vitamin D level also helps in impact fighting COVID. So making sure that you're taking vitamin D if you need it. A lot of times I have to have patients take iron supplements, especially if they've had this excessive bleeding. Magnesium, a lot of times I'll add in because that helps with muscle cramping and it relaxes the muscles. And occasionally B vitamins, depending on what's going on. Right. And the herbal part of it, I'm not sharing, not because I'm trying to keep it a big secret, but herbs are so specific to what the person has in front of me. So it's not like I'm going to be like, hey, go get this formula and it's going to be right for you. And not all acupuncturists are herbalists, but when we do prescribe them, it's very specific. We need to have that person in front of us and look at the pattern and see that that formula is okay with them. It's not like, don't go to Amazon and be thinking you're going to get formulas, and you shouldn't be. That should not be where you get your formulas. Get them from your acupuncturist so that you know that they're good quality.
Right. Because there's a big span of quality out there.
Yeah. So, and our next podcast in 2 weeks
will be about allergies and treating allergies, pets, pollens, foods, fabrics, and medications, even stimuli like EMFs from computers and stuff like that. Even tissues in the body. People become sensitive to their own digestive tissue, hormones, you name it. This system treats all those things. I've been using the system for 11 years, and the people who came that first year are still allergy-free.
Excellent.
To whatever we treated then. They haven't had to come back since then.
Cool.
It's really quite incredible. I had someone the other day who needed to start taking a medication and got abdominal problems from it, vomiting and upset stomach. One treatment and no symptoms.
Excellent.
And now it's been, I think, maybe a month.
Cool.
Without that.
So we'll get into that.
This time of year, dust, mold, dust mites, stuff like that. Even with the trees and the rain and stuff like that, create a lot of mold spores in the air, and everyone's suffering from that. And a few treatments, and they're fine.
Excellent.
Yeah, so we'll talk about that.
Excited to hear about it.
All right.
So I will see you in a couple of weeks. Thanks, Ming,
for
letting us host here. We appreciate it. Bye, everyone.
Thank you all. The contents presented during the Practical Medicine podcast include information about various modalities that exist to achieve health and wellness and are for informational purposes only. You acknowledge and agree that the following disclaimers and warnings shall apply to all content presented.
The podcast contains the opinions of Dr. Robert Balko, DAC, LAC, and Dr. Stephanie Lipnicki, DACM, LAC, and the guests of their show. The content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you have regarding any medical condition.
The views expressed in the Practical Medicine podcast are our own and do not represent those of all licensed acupuncture professionals. Always seek the help of your own acupuncturist or medical provider to determine your best course of action. You may want to use the information presented as a supplement to better understand your diagnosis or treatment, but it should not be the sole thing that you use to make important medical decisions. Do not use the content of the podcast in lieu of medical advice.
Never disregard professional medical advice or delay seeking care because of something you have heard on this podcast. Privacy is important to us, thus all people, places, and scenarios have been changed where applicable to protect privacy and maintain confidentiality.